We can.
Should we wait a couple of minutes, sir?
You can start. Those who want to join, they would join.
Okay, sir. So good evening, everybody. And on behalf of Team IIP Mumbai, I welcome you all to this online CME on Voice for Clean Air. So as we are all aware that the 5th of June is celebrated globally as the
We can't hear
the
you.
impacts
Yeah. Neil, we can't.
environmental pollution.
Neil, we can't hear you. Once. Your internet.
Am I audible?
Yes.
Yeah.
Yes,
Now
Okay.
you.
So good evening, everybody. And on behalf of Team IIP Mumbai, I welcome you all to this online CME on Voice for Clean Air. And as we are all aware that the 5th of June is celebrated globally as the World Environment Day. Using a global platform, there is an attempt to create awareness on the increasing impact of environmental pollution on the health of various individuals. I mean, all individuals. We know that there are a lot of hazardous effects of the environmental pollution on various systems in the body. But today's CME has a focus especially on the respiratory health and respiratory system of children, mainly because we're all pediatrics and our stakeholders are we looking at kids, but of course to adult individuals also. So we are all aware that there is increasing urbanization, industrialization, improving infrastructure probably happening at the cost of individual health. At any given time, if we are focusing on Mumbai, there are more than 62 to 6,300 active construction sites. There is an increase in the vehicular numbers day by day, and pollutions and suspended air particulate material contributing to air pollution due to that as well. So what do we do about this AQI? And this CME is primarily going to focus on what is changing, what do we look at in future, how we as primary healthcare physicians and others can work towards any kind of policy making and a change in their approach to get the respiratory health of the young lungs better. So we have a galaxy of experts today. We have pediatricians, we have pulmonologists, we have stakeholders, we have activists who are working actively on environmental health since last few years. And we have IITians who have contributed to the technology and the improvement in implementing the AQIs and the rest. So with that, let not these be just slogans. Eradicate pollution, save the environment, green earth, clean earth is our responsibility. Your planet needs you. Act now. I think this should all not remain on paper, but I think we should all become very proactive in working towards it. So with this small introduction and welcoming, I will now request our IAP chairperson of the National Respiratory Chapter, Dr. Sanjeev Rawat sir, to kindly come in and say a few words about this. Thank
Thank you, Dr. Nair, and good evening, all. Good evening, all dignitaries, and very warm welcome from IP National Respiratory Chapter. As you all have heard, Dr. Nair Shah, the 5th June every year is observed as a World Environment Day, basically to remind all of us to double our efforts to preserve our environment and our planet Earth, because our existence, it depends upon a healthy earth and safe environment. Now you have heard Dr. Nair Shah regarding various causes, but what is the basic root cause of all these problems of environment? Basically, it is everything comes down to only one specific reason: human being. We are solely responsible for all the mess we have created. We have created indoor pollution, outdoor pollution, deforestation, loss of biodiversity, and the entire environment has become a mess. The proof of this is, if you remember a couple of years back in COVID-19 epidemic, when all human beings were indoor and all activities were at standstill, environment has become absolutely clean. All the diseases, respiratory diseases had come to absolutely at the lowest level. And as soon as the epidemic went away and activity started again, the thing are back to square one. So I think it is we who are responsible for all mess we have done. Now we know the problem, but solution. For solution, we always look to the government. Government will do something. Government will act. They'll make some regulation. But I think if you don't act at an individual level, if you don't take our responsibility and try to act and try to give our own contribution in maintaining a good environment, things are not going to change at all. So basically, IPNRC has taken a lead and they have decided to increase the awareness, contribute to our own effort to improve the environment. So by this particular CME, where we will be focusing on indoor as well as outer pollution, we'll try to see for some causes. What are the causes of outdoor indoor pollution and what are the remedies? And let us hope that at the end of this CME, we have some substantial guidelines, substantial way forward in which we all can adopt them and we can make our earth more healthier, sustainable, and ensure a good, healthy future for our future generations. So let us join hands, let us work together, let us learn together, and work towards the healthy environment. Thank you very much. Over to Dr. Nehal Shah for subsequent proceedings.
Thank you so much, sir, for that. I would now like to request our past president, IIP Mumbai, and who is also a kind of a media spokesperson for our central IIP, Dr. Sameer Dalwai, to please come in and say a few words.
Namaskar. Good evening, Dr. Rawat sir, Dr. Modi ji, Dr. Bafna ma'am, Dr. Bafna ji, as well as all the eminent speakers today, as well as my friends from IIP Mumbai, Dr. Nehal, both the Dr. Rajesh, Sikha, Jagruti, and all the members of the NRC, as well as IIP Mumbai who are here today. Nehal has given me 30 seconds. I'd only like to say that one of the most popular dialogues in Hindi film cinema is "Mere paas maa hai." अमिताभ से मेरे पास गाड़ी है, बंगला है, बैंक बैलेंस है, क्या है तुम्हारे पास? मेरे पास माँ है. Unfortunately, we have to realize that Ma, that is Mother Earth today, is being sacrificed for Gadi, Bangla, and bank balance. Exactly three reasons which are causing a lot of pollution and all what Dr. Rawat said just now and what Nehal was saying. So it is this Bangla, Gadi, bank balance that people want to live for their own child. That they are doing all this and creating pollution for, not knowing that this pollution is going to destroy the very world in which their children for whom they are saving all this is going to be. People tell us that we should practice yoga and that's very good for the lungs and breathe in and out. But I feel scared now to breathe in too much, because if you breathe in too much, more of dirty air is likely to go in. So the question is whether we should breathe deeply or not. So I'm sure the NRC experts will tell us today. But finally, at the end of the day, we've been advocating, Dr. Ambedkar, myself, and many other people, that we need to have a separate ministry for children and adolescents that will focus upon the dangers that children are facing today, which is far more than the same problem that adults may be facing. And that is possible only if all of us get together and make this demand that children are not half adults. So you can't give half a paracetamol to a child because you give a full paracetamol to an adult. And that's why we need to draw a special occasion, because if environment is bad for adults, it is 10 times worse for children. I think these are the things that are very important for all of us to look at, present, and create an entire environment around the country that makes the government understand the importance of children and issues like environmental pollution which harm children, and raise a voice for clean air. Thank you so much for the patience. Thank you very much.
Thank you so much, Dr. Sameer Dalwai. And I think now, without wasting time, let's begin with our two panels and one talk which is going to focus on indoor pollutants and indoor allergens also, which form a major cause of the increasing respiratory non-infectious diseases. So I will invite Dr. Jagruti Sanghvi, who is Treasurer IIP Mumbai 2025, to kindly come in and start the scientific session with the first panel.
Thank you, Dr. Nehal, and a warm welcome to everyone who's come here for this discussion on World Environment Day about air pollution. It is said, I'll start with a poem. I think Sameer has inspired me, that वायु प्रदूषण की समस्या तब से आई है, इंसान ने अपनी ज़रूरतें जब से बढ़ाई है. तरक्की की खातिर हमने बहुत बड़ी कीमत चुकाई है, अपने ही हाथों से हमने हवा को जहरीली बनाई है। अब इस शहर में नहीं चलता शुद्ध हवा का झोंका। सोचो कौन कर रहा है किसके साथ धोखा। अभी नहीं संभले तो संभल नहीं पाओगे। आने वाले कल में शुद्ध हवा के लिए तरस जाओगे। तो आओ आज के इस वेबिनार में शिक्षा और जागरूकता से यह क्रांति लाए और वायु प्रदूषण की समस्या को जड़ से मिटाए। So, looking at today's wonderful day of World Environment Day, we as Indian Academy of Pediatrics, Mumbai, as well as the National Respiratory Chapter, are bringing together ambient air pollution, its impact on child health, and what we can do about it. It's not just about trying to find the problem, but also trying to seek a solution. So, we all know that it's a silent epidemic, and in a densely populated city like Bombay, we are actually struggling to breathe. The AQI is constantly going high in metro cities. And today, therefore, we'll hear how regulation needs stronger enforcement, how science can guide targeted interventions, and how we as pediatricians, not just as professionals, but also as responsible citizens, can actually make an impact. With much like not wanting to really spend a lot of time on this, because Dr. Abhinaya, a pediatric pulmonology fellow with Dr. Indu Khosla, is now going to bring up and moderate a very excellent session on ambient air pollution and its impact on child health. Over to Abhinaya.
Thank you for introducing, ma'am. I will just share the screen. Good evening to one and all. So on this occasion of World Environment Day, we are having the CME. So our theme is Voice for Clear Air. So our first panel discussion is going to be chaired by panelist Dr. Indu Khosla ma'am. We all know her. She needs no introduction. She is a senior pediatric pulmonologist at Narayana Health SRCC Children's Hospital at Nanavati and at Dr. Zindu's Newborn and Child Care Center. She's an eminent pediatrician for the last 35 years. And ma'am is has special interest in air pollution, and today she'll be one of our panelists. I warmly welcome our second panelist, Mr. Piyush Kedia sir. He is actually an IIT Bombay graduate who is director of the Silverleaf Capture Services, and he is very passionate about environment and is actively fighting for Mumbai's air quality since last 3-4 years. I warmly welcome you, sir. Our next panelist is Mr. Pradeep Acharya. He is a senior correspondent in the Indian Express Group, and he is actively interested and he reports on civic issues, local governments, environment, and policy making. So, as you see, he has written the famous articles and he has reported on air pollution in Mumbai in the Indian Express Group. I welcome you all to our panelists. So, now let us start our discussion. Our topic is ambient air pollution and impact on health. So, my first question, before starting in the question, I think I wish to share one, a case relevant to our discussion today. So, a few months back, we had actually had seen a 4-year-old male child from Gujarat who presented with persistent dry cough, fast breathing, with mild fever for 3 months. He had multiple OPD visits. He was treated with nebulization, inhalers, oral steroids, but he was still coughing, so he was referred to us. We had also seen him, he was coughing, we gave him inhalers, and so he presented to us after 10 days with again complaint of increase in cough and breathlessness. So there was no history of weight loss, there was no family history of asthma, no TB contact, nothing, no obvious environmental allergens. On examination, he was well grown, he was tachypneic, and he had bilateral crepes on knees on examination. So we had investigated him, we admitted him, he had eosinophilia. So we were thinking there is inadequate response to inhalers. He also had some wet cough. We were thinking whether there is any persistent infection or it is protracted bacterial bronchitis, hypersensitivity pneumonitis. We did CT scan, and the CT picture was showing an interstitial pattern of lung disease with tiny nodules, peribronchial thickening, and the report came as query acute or subacute hypersensitivity pneumonia. So, on thinking of hypersensitivity pneumonia, we went back to the history again. Then we found out that the child started going to school, since last 3 4 months, and he was traveling through a van. And then in the journey was 20 kilometers, and almost 17 kilometers he was passing through a black stone quarry. So we found out probably this is the source of his cough. We treated him, and then we advised the strict avoidance of the allergen. And now the child doesn't go through this route. He wears mask during travel, and child is now completely better. Now he is coming, for follow up regularly, and child is absolutely better just by the avoidance. So I think this is a wonderful case which shows that how an environmental pollution can affect one child's health. So my first question is Dr. Indu Khosla, ma'am. Ma'am, so are you observing a rise in wheezing and chronic cough in children? And if yes, what do you think can be the cause?
Okay. So after the lockdown opened up, we definitely saw an increase in the number of children who were coughing. There was the multiple theories to the effect that it could be probably because of the immune debt, where these children were not exposed to any, infection, where they were following hand hygiene and probably masking themselves, not going to schools, so they were not getting an infection. So we had rampant amount of cough. But even if you forward to follow any textbook or any obvious cause why these kids are coughing, the coughing was far beyond what we can actually see. And the last 2 3 years we have seen that the amount of cough that children are having and the persistence of cough, persistence of wheezing, is definitely much more. So I'm not a researcher, so I cannot give you figures, but having said that, the number, and this was a phenomena which we were seeing all over the globe. So we have various pediatric pulmonology sites called PEDLUNG, where people from all over the globe were talking about increased cough, and much more in India, where many of our respiratory groups, we were talking about increased amount of cough, which was just not going. So cough causes could be are very many. Of course, infections is the commonest. Asthma and allergy is definitely a very close second. But I think the amount of environmental triggers. So we have seen a huge upscale of construction activity, infrastructure activity, which has gone up phenomenally over the last 2 3 years. So somewhere something else is also triggering off. As I mentioned that I'm not a researcher, but definitely this kind of cough we have not seen in the past. So something in the last 2 3 years. Staying in the city of Mumbai, we always thought that Mumbai was clean, and we always thought pollution was more related to Delhi and the other parts or the northern part of the country. But we also seen that AQI in Mumbai is also worsened over the last 2 3 years. So therefore, increased infrastructure activity, increased cough in children, worsening AQI. I feel definitely that environmental factors are a possible cause that we are seeing more children with cough and wheezing.
Thank you, ma'am. My next question is, what are the most concerning hazards of air pollution on a child's health?
So it is commonly believed that the impact of cough on child's health is predominantly pulmonary. But I would wish to expand the horizon for the listeners today, that the impact of pollution starts in utero. So if a pregnant mother is exposed to air pollutants, the child whom she's carrying can have smaller lungs, the child can have stunted growth, and so the impact starts in utero. And after the child is born, if the exposure to such things continue, you have more higher risk of respiratory infections, because the defense mechanisms of the lung are impaired with air pollution. So higher risk for pneumonias, more allergies, rhinitis, asthma. In fact, the new GINA 25 guidelines say that even if you do not have a family history of asthma, and if your child is coughing, it could be asthma. So it's probably some trigger is triggering off asthma. Beyond that, we have higher risk of premature death, so shorter lifespans, stunted growth postnatally, and long-standing exposure to pollution can cause right from COPD in adults to cancers to cardiovascular risk factors. So the list is quite endless. Premature births, so the list is endless. So I feel and we should also know that there are a lot of neurological side effects, cognitive delays, developmental delays, even autism. So all these diseases are multifactorial. but somewhere down the line, pollution is also contributing to it. So to do a research and to say it's only pollution is difficult to say, but yes, we might need to keep it in mind because these things are on a rise.
Thank you, ma'am. And my other next question is, are there any recent studies that link worsening air pollution levels to an increase in the pediatric respiratory diseases?
So there was a study published in 2021 with Dr. Varinder Singh and his group, which linked the level of AQI and the respiratory illnesses. In 2019, there was a publication in Indian Pediatrics which talked about the infant mortality rate, which has come down from 43 up that we started to almost 28 in 2023, and 8% of causes of death in the infant mortality under 5, sorry, not infant, under 5 mortality rate was because of air pollution. This is a large study which looked at pollution related deaths, premature deaths or shortening of lifespans across all the states in the country. So yes, there is data from India also, and there is of course international data. So there are a lot of studies which are now speculating and linking pollution to cause of increasing pediatric respiratory diseases and even other diseases.
Yes. So now it's a well-known fact that the air pollution can cause significant, impact on child's health, and definitely it causes an increase in the respiratory diseases. And this is the study which ma'am had quoted in 2021. And ma'am, the aim of today's program is to create awareness. So what role can parents and pediatricians play in minimizing a child's exposure to air pollutants?
So I think as pediatricians, we need to educate the parents. Okay, so we need to educate the parents as to what could be the first for the cause of indoor air pollutants. So we need to ask them to avoid those indoor air pollutants, and what are the causes of outdoor air pollutants. Say for instance, if a child is, we are talking about air pollution, but suppose a child is allergic to pollen and there's a specific time of the day where pollen, or for that matter dust, is more out in the atmosphere, you should avoid the child, ask the child parents to avoid the child going outdoor or playing or doing outdoor activities. So the first thing is education and avoidance of the triggers. That's the first thing which is most important. Wearing a mask if you're going to a dusty place could definitely help. Improving the general health of the child, vaccinations, nutrition also helps the improve the lung defense mechanisms for the children. Also, I think as pediatricians, we need to create awareness at a community level. At community level, so if we can educate, we can even talk to schools when they should allow the child to have outdoor activities and when the child should have indoor activities based on AQI. So a sensitization is extremely important as pediatricians, and to identify. See, I'll tell you, we don't even when we take a history of our patients who come with cold cough, we ask all possible histories, but today environmental history is extremely important. So as a pediatrician, we need to prepare ourselves that this is, so even the patient that we discussed, we didn't think of the environment first, it came
Yes, ma'am.
as a hindsight. So even that I think is very important. This is a message that I would like to give pediatricians.
Yes, ma'am. So as you said, are there any air quality guidelines that schools and childcare centers should follow?
Yeah, so there are guidelines based on the
I would,
AQI. Yeah, if you have this, you can show it. There are
yes.
guidelines based on, this is from CDC. So depending on the AQI, one could have children allowed outside, or just say if the AQI is less than 50, it's a great day, you can be outside. If the AQI is between 50 and 100, you can still allow them outside, excepting children who are asthmatic or allergic. Those kids, you may have to put some, kind of say inhibitions for them. But if your AQI gets worse and if it gets into the zone of red or purple, we need to definitely control all outdoor activities. We need to restrict the duration of time that the child is outside. Intensive activities like running a marathon or doing excessive physical activity outside should be avoided. And I think as pediatricians, we can make these guidelines and send it across, maybe to the health ministry, maybe to schools, so that schools can follow these guidelines, so it can become a norm. And this will also sensitize them, it will make them aware, and people will start thinking. When they start thinking, they will demand their rights, right?
Yes, ma'am. Thank you, ma'am. And then now I welcome Mr. Piyush Kedia. Sir, welcome you. So my first question to you is, how did you begin your journey in the fight against air pollution?
Right. So yeah, as Dr. Khosla and the other doctors on the panel correctly said, the exact same thing happened with my, at that time, 3-year-old, where the moment the lockdowns were lifted and the pandemic ended, he started coughing and like he would wake up in the middle of the night coughing. And if he moved out of Bombay for a few days, it was fine. It was completely fine. And so I realized that this is something, related to Bombay and related to the air. And before that, I did not even know that it was this bigger problem, right? And our pediatrician literally told us to leave the city if we want like a proper solution for this, right? So from there I said that if my child is suffering, other children are also suffering. And then I realized that in my child's school in South Bombay, there were at least in his class there were quite a few kids who had had their adenoids removed, which is also, I believe, to do with air pollution, right? And like, not being from the medical community, I did not even know up till now what adenoids were, right? So from there I decided that we should do, something needs to be done about it. If the impact is so crazy, something needs to be done about it. And so I actually reached out to Anant from Indian Express and Pradeep, who's on this panel, and these guys went all in. And then once they got involved, the next step was a few lawyers got involved, and these lawyers are like the best guys. Money. No, so I think from their reporting first, from Pradeep's reporting specifically, the court initiated a suo motu PIL, and from there, like we could get like a very good NGO involved, and we got like the best lawyers that are there in the city. They got involved, and slowly it's become something that has led to some reasonable action, but it's still not as fast as how serious the problem is, right? It's not being dealt with this with the urgency, or at least the outcomes are not, in line with how big an issue it is.
Yes, sir. So, my next important question is, what are the primary pollutants, affecting Mumbai's air quality and their source, sir?
Oh, so if any, so the number one is any form of open burning. Like this is, and I'm saying this, I'm not an expert on this, but this is based on my conversation with the experts. I think the number one thing that has been told to me is any form of open burning, especially garbage burning. One, right? Because that is the most toxic pollutant that is there. Uh, uh, Industries around us, including the power plant and the refineries, and for some reason we still have like RCF running a plant making fertilizers in the middle of the city. Then heavy duty diesel vehicles, and in theory, the biggest polluter is road dust, road and construction dust. So yeah, these three, four sources are the biggest sources that need to be taken care of.
And then, have you observed any seasonal variation in pollution level, particularly linked to climate change?
Uh, so it is, there are some studies that say that the wind speeds have slowed down, right? And so the winters, especially the winds reverse, and so because of that, we get like bad air from the eastern parts of the city back into Mumbai, and that air doesn't get filtered out for many days because the winds are slower, and yeah, so that leads to uh, prolonged periods of very, very bad air.
So, is the global warming also somewhere indirectly, causing all these increasing AQI levels? Do you think so, sir?
The wind speed reduction is probably linked to global warming, but yeah, again, I'm not an expert on this, but they have attributed the reduction of wind speeds to warming of the oceans.
Yes. Okay. Thank you, sir. Now, my next question is to Mr. Pradeep Acharya. He's the senior correspondent in Indian Express. Sir, you have been reporting on Mumbai's air pollution like for many years now. So, based on your experience, how has Mumbai's air pollution evolved over the past decade?
Good evening, everybody. First of all, thank you so much for having me. Am I audible, everyone? Like
Yes,
you
sir.
can
Yes,
hear
sir.
me?
Clearly audible.
Yeah,
Yes.
yeah. So over the side, like I have been reporting on Mumbai's air pollution for more than like it's more than like 6 years now. And the issue of air pollution in Mumbai, it actually started to spiking up after around 2022, around 2022, yeah, from the winter of 2022, which was actually the time when Mumbai actually saw a lot of number of bad air quality days. Because I still remember between November and January, out of the 90 days, 92 days, around 62 days, we had seen either air quality of poor quality air, or very poor quality of air. So it was during that time, no such intervention was there. I mean, be it at I mean, there were rules in place, but intervention were not there at the ground level as much as we see today. I mean, today there is a lot of awareness. Today, the fact that we're speaking about it is probably because what triggered in 2022. So it was during the winter of 2022, we actually saw the air quality going down. And after that, in 2023, the air quality started dipping from the month of, usually in Mumbai, the pattern of Mumbai is after Diwali, after the month like October, like around the period of Diwali, the overall air quality starts deteriorating. And during the month of like December, January, February, we see a large number of bad air days or moderate air days. And after the month of March or April, it starts to improve. So what we saw the next year, which is in 2023, that the air quality of Mumbai started really going like it fell on the nose starting from the month of October. Like the rains were there till September end or first week of October. So by around first week of October, we were seeing like the air quality going down. And after that, like as Mr. Kedia mentioned, we started a campaign, like we called it the Death by Breath, and which brought a couple of, matlab, the government level intervention on it. But coming back to a question based on your experience, like how has the city's air pollution has evolved over the past decades? I would say it is not has improved as much as in the past 10 years, as much as it has like evolved in the past 2 3 years. And specifically, this is because like what I can make out of it is because at present the city is witnessing a lot of infrastructural churn that we are seeing. Like we were seeing the Mumbai Metro coming up like a few years ago, like all entire almost the South Mumbai's waterfront was dug up because of the Mumbai coastal road. Then there was the Atal Setu. So this factors amalgamated with some of the climatic factors, which I feel have, kind of uh, led to the change in the quality of air.
Yes, sir. Thank you, sir. We all know like basic sources of air pollution. There are so many noises around this construction metro. But do you think there is any other source of air pollution which is most overlooked in the public discourse?
See, the BMC and the MPCB in 2023, around March on April, like after like I remember, like what I remember is they came up with the Mumbai Air Pollution Mitigation Plan, which is called the MAP MP. So in that overall plan, they have pointed out top 4 5 sources that were identified as one of the key contributors behind the bad air quality in Mumbai. So the major source was the road dust displacement.
Okay.
And another major the source was attributed to the vehicular emissions. So these two were one of the top two. Then there was also the construction dust, and there was also the open burning of garbage, and then there was the the emission that happens from the open bhattis, the restaurants that we see, the eateries in the cow gullies of Mumbai that we see. These were some of the these 4 5 factors were some of the ones that they were identified as to be the key contributors. So, but kind of the sense that which I would like to say, like these factors are already there, like these sources are already there identified. But are they being like intervened at the ground level? That should be the question.
Yes, sir. Thank you, sir. And then, so this was shared by Piyush sir sometime last week. Sir, do you want to say anything on this picture which you had shared last week to us?
Mm,
Hello, Piyush sir?
This
yeah.
is in line with what Prateek
Yes,
just
sir.
mentioned,
Yes,
and
sir. Yes.
uh,
My next question is to both the panelists, Piyush sir and Pradeep Acharya sir. Sir, in what ways the government is working towards air pollution mitigation? And what are the challenges which policymakers face while enforcing the air quality regulation? Pradeep sir?
Oh, you want me to come first?
Yeah,
So
anybody.
at present, okay. So at present, like the state government, I mean, as we speak, I mean, I'll just try to uh, uh, like answer your question in one line. I'll try to, because today we also saw the BMC, coming up with a environment budget. So of the environment budget, so the BMC has attributed, like they have earmarked around 16,321 crore, which will be, used for several, environment related activity, of which around 101 crore, which is just 0.6% of the total budget, has been attributed just for air pollution mitigation plan. So I think the government stakeholders, I mean, there are a lot of noises that are happening, because the I can feel one thing, that the government's main focus area is to, transform the kind of vehicles that you use, because now the government or the stakeholders, be it the local urban body government, be the BMC, or be this even be the state government, with so many subsidies around, their primary focus right now is to transform the use of mobility, which is, transforming the BST buses and all the government bus owned buses to either CNG fleets or the electric EV fleets. But again, for that, you need to have a proper roadmap for road transport. Because if we see the total, like BST's fleet strength, it is just 2,800 buses, 2,800 buses. And Mumbai has one of the most, like not the one of the most, it has the highest vehicle private car density in the country.
Yes.
So within every 1 kilometer, we have around a density of 500 cars, and which might have, I mean, this is the data that I'm giving of 2022-23, and I'm quite sure that this has increased by now. So this is the overall scenario right now, because the in what ways the government is working towards air pollution. So they are promising that they will try to transform the overall the fleet size, because for them the primary objective is to bring down the carbon emission that, is caused by vehicles.
Okay, so their primary work is in the, the transportation and then bringing the EV buses. And what challenges do policymakers face while enforcing all this strict regulation? Piyush sir?
I think the biggest problem is, like, for the long run, it is like they don't have the capacity to enforce these regulations, right? Because uh, like let's so they have, for example, come up. BMC has released this app, which is a part of this PIL we're speaking about, where the court, got this done. But now there's an app called Mumbai Air, and on that app you can make complaints about air pollution, right? But if you actually make a complaint, there is no response to it. There's no one responds to it. And, like, I feel bad for BMC, right? Because they built this app and they're serving, like, now like a few crore people doing it. But where do they have the capacity to respond to these complaints, right? Because I believe overall between these organizations, the number of people deployed to air pollution is very, very small. It's alarmingly small, right? And, like, if you compare it with, like, say, the California Air Resources Board or any other body like that, they have like you know teams of, like, thousands of people with, like, a few hundred scientists and engineers on their body, working full time on the air quality for the city, right? And or for the state. And, like, you compare that with here, we're alarmingly low in terms of our capacity to handle these issues.
Okay, so our problem is starting with the capacity only. Sir, and my next question is, are there any successful pollution mitigation strategies from other cities that Mumbai could adapt? Piyush sir?
Yeah, I want to answer. So, Professor Tripathi is on this panel. I don't know if he's joined, but he will not well. I hope he has joined. But he's like a you know pioneer innovator in this field, and like, we're fortunate, like the country is fortunate to have someone like him on doing research in this field, right? Now, one of the things, like, Korea and Beijing have actually published documents and said what worked for them, that there are things that work for them. And so Seoul has done this as, like, a blueprint for other cities that want to deal with their air pollution and improve things, right? They've recorded their actions, right? And both these places, one of the things that they have said is they have basically used a very dense monitoring network, right? So, like for example, right now in Mumbai, maybe there are like 15 or 20 locations where air quality is being monitored continuously, right? That is very very low, right? Because you don't know where the sources are. We know that road dust is a problem, but where is most of this road dust coming from, or which how do we identify where the problem lies, right? So all the large cities have adopted this. Even London, New York, Dubai, these cities have all uh, taken up some form of very very dense monitoring networks, and we have like we're lucky that we have the best names in our country to do this, but for some reason this has not been implemented, right? And I don't know what the reason is. I have gone myself to PMC and insist, like, convince them that they should be doing this. They seem to be convinced, but yeah, we've not seen action on this, right? This is one of the things that we need to adopt. Secondly, some capacity building so that simple things like if someone is burning garbage every day next to me and I complain about it, some action should be taken, right? That's absolutely not happening.
So basically, we have to improve our monitoring, and then there should be a facility for addressal, and somebody has to take action. That's what I
Yes.
understand from you, sir.
Yes.
Sir Pradeep, sir, you want to add any points?
Yeah, if I may add with the previous question that you had asked, I mean, regarding what are the challenges that policymakers face? I mean, I think that was
So,
one of the questions.
yes, sir.
So
Yes.
I would say the one of the key challenges that the policymakers today are facing is that, that there is a bureaucratic red tapeism that is there. Because, the issue of air quality, it involves not just the BMC, I mean, but there are multiple agencies that are responsible for mitigating this issue, which starts with the MPCB, Maharashtra Pollution Control Board. Then there comes the BMC. Then there is also the State Environment Department. All this, and so the basically ER doesn't have any jurisdiction, right? I mean, for example, if you like burn garbage in Kalyan or if you burn garbage in Navi Mumbai, the yard doesn't have any jurisdiction. I mean, the yard shed is the same. I mean, the yard it can anyway it can start if the yard is blowing towards Mumbai, the particulate matters can easily come down here. So that is something that is happening very rampantly because in Mumbai, still being the financial epicenter of this country, we are aware there is a discussion going on. But a lot of these discussions are not happening in terms of the satellite cities, which falls under the Mumbai metropolitan region. And why I say there is a political, sorry, there is a bureaucratic retipism that is there is because, for example, there is a lot of passing the buck game happens between these agencies. For example, if there is some intervention that is needed for the MPCB is the pollution control board. They can't, enforce. They are not enforcement bodies, so they don't have actually the manpower to penalize someone to reprimand someone who is breaking the laws. For that, they need support from the BMC. But again, the BMC will need some kind of red tape clearance to go ahead and coordinate with the this interdepartmental coordination is something that needs to be very smooth because at the end of the day, it is the same air that all of us are breathing, be it the bureaucrats, be it us, or be it anybody. So
True, sir. True. So there is no coordination, and we have to like improve the coordination and the communication between different departments in different regions. Yes, sir. Valid point. So, do you want to add on this particular question? Like, can we adopt any strategy from other countries to Mumbai city?
I mean, like Mr. Kedia rightly said, I mean, there is a lot of, I mean, the first and foremost step to stop any problem is to identify it, right? Unless and until, and especially I'm sitting in a elite panels of doctors, and I mean, they will like they are the best person to to say this because unless and until you can identify a disease, you can't cure that disease, right? You can't prescribe medication for that disease. So the first and foremost that is needed is a proper identification. And in a city like Mumbai, we don't have the adequate resources to identify the air quality. I mean, like there are 26 municipal wards in Mumbai, and even if we say that going by the math, if there is one air quality monitoring station per municipal ward, it is not enough because especially Mumbai has such a Mumbai, each of the Mumbai's wards are so big in size and it houses such a large number of pollution. It has varied demography. So we need more, local level monitoring. Like Mr. Tripathi is the right person to speak on this because he has
Yes, sir.
done a lot of local level monitoring on this, and he's a pioneer of that. So a
Yes, sir. Our
lot
next
of because
session
unless and until you identify the sources, how are you going to mitigate it?
Yes, sir. Next session is on that. So my other common question to both of you is like, how, as a common man, we can fight against air pollution? Can just keep it little short because we are running out of time.
So I'll not answer for the common man, but I'll answer for pediatricians. That
Yes, sir.
if you all can officially issue advisory, because in Jan and Feb is when all schools have their sports days and like you know other outdoor events, and because that's like otherwise it's raining or it's too hot. So this is like the time when the weather is good, and this is also the time when the air quality is like horrible, right? And like I've had attended my son's sports day and like sports events in like 300 plus ACY mornings, right? So if y'all can officially start giving advisory, that would be really really helpful because that adds
Definitely.
like there's no one that brings that much credibility as pediatricians and
Yes.
doctors.
Yes, sir. Yes, sir. So and then there is other important question is, so I know you're all part of the legal proceedings, so I just want the audience to know, so what, legal proceedings or legal actions being taken by the public regarding the air pollution, and how as key opinion leaders we also can raise awareness.
So you want me to
Yes,
comment?
yes,
Yeah,
sir.
Pradeep,
Piyush,
please.
yeah, anybody.
Yeah. So basically, like the legal movements public movements are not happening in as such a mass scale like it should be. I mean, we can see what is happening in Delhi, but again, Delhi has become a yardstick for that. I don't know if that is a good thing or a bad thing, but the defense mechanism that the administration over here that they have is we are not as bad as Delhi. So this, kind of sends people into a kind of a delusion that even though, I mean, like Delhi is much worse, we are much safe in Mumbai, but which is not the case right now. And also right now, the lot of discussion is happening is because the air quality in Mumbai has mainly deteriorated over the past few years because of the infrastructure work and everything that has been going on, because this is mainly because of man-made factor. So once that it is controlled, again the Mumbai air will become free to like fresh. It will become very like easy to breathe. So unfortunately, no big scale public movement has not happened as of yet. There have been sporadic local, interventions where people like you write to the BMC municipal commissioner or the MPCB chairperson or the state environment minister. Then some small level, local level action like is being taken, but it again gets diffused over a period of time.
Okay, sir. Piyush, sir, you want to add any point?
No, that's it. That's good.
Yes, sir. I think. Yeah, so thank you so much, for, joining our panel discussion. So key takeaway from this panel discussion, I would say that Mumbai's AQI is worsening, and there is a research, though there is not adequate research, but definitely there is a research showing that worsening air quality will impact our health, not only respiratory but the general well-being from head to toe, and we have to definitely take action. And the important takeaway is we have to find the source of the pollution. For that, we require adequate monitors, and we have to take action based on these sources, like from the road stress, construction activities, and then we should have a good redressal, mechanism so that people can complain and then action can be taken. So, now I invite Dr. Jagriti Sangvi, ma'am, for the second panel discussion. Ma'am is an eminent pediatrician, and she is also an adolescent health specialist. She is our treasurer in the Indian Academy of Pediatrics, Mumbai. I welcome you, ma'am, for the second panel discussion. Over to you, ma'am.
Thank you, Abhinaya, and a huge thank you to the three esteemed panelists from the previous session. I hope I'm audible.
Yes, ma'am.
Yeah. So there is probably a lot of overlap in both the panels, but we have got such esteemed panelists that we could not actually, kind of curtail this entire discussion that Dr. Indu Khosla spearheaded so well to just one small session. So, and I have another three panelists who are absolutely precious for our discussion today. I invite Dr. Yeah, I now just say,
I'm sharing the
yeah, please share, Dr. Yeah. I invite Dr. Jagdish Shinappa, who is a respected child health expert consultant at Bangalore, and he's been the past president of the respiratory chapter of Indian Academy of Pediatrics. Welcome, sir. Then we have a very renowned professor and inaugural dean of the Kotak School of Sustainability from IIT Kanpur, Professor Sachidanand Tripathi. Sir, we are extremely honored to have you here, and the amount of pioneering air quality research work that you have done is tremendous. Sir has directed Atman, which is Advanced Technologies for Air Quality Monitoring, under the Make AI in India mission. He's also been awarded numerous awards, prizes, medals, and he's been awarded the Alexander von Humboldt Medal in 2024 for exceptional research in developing research. We're extremely grateful, sir, that uh, you have honored us by being here on our panel today. And our third guest today is again somebody who is very, very special for this particular topic. And we are extremely honored to have Sri Siddesh Ramdas Kadam, who's the chairman of Maharashtra Pollution Control Board. Thank you so much, sir, for accepting our invitation and in your busy schedule to find time to talk to us as pediatricians and citizens of this city. So warm welcome to all of you from on behalf of IIP Mumbai as well as the respiratory chapter of IIP. Um, Today's discussion, as we gathered from how Abhinaya has steered the previous panel, is not just about trying to, talk about the impact of pollution or air pollution on children, but it's also trying to figure out what does that impact doing, and what we as stakeholders, as pediatricians, as citizens, are able to do anything that we want to change. And today, there could not have been a better day than this to at least start off this conversation. And it should not just stay in these webinar rooms, but it should go to our clinics, to outside, to like wherever we go. And we should be able to kind of start a movement. And I think that is what Dr. Indu Khosla's vision is about today's webinar. So I, I would like to start off with, again, a pediatrician related topic. So, Sir Dr. Chinappa, I would like to start with you. And I would like you to elaborate on the latest GINA guidelines. GINA is basically Global Initiative for Asthma Management in Children. And we as pediatricians, like I am probably practicing for 20-25 years, and about 20-25 years ago, we wouldn't hardly ever think about allergies or anything actually happening in children to cause such bad respiratory conditions. But in the past 2 decades, we have seen a sea change in the number of respiratory problems that children come, and it's like every third child could be having an allergy. So looking at that, the latest GINA guidelines, which were published just very recently in May 2025, they have added a new section about the impact of climate change and extreme weather on people with asthma, not just from the infrastructural perspective, but also the direct effects of asthma. So Dr. Chinaba, can you kind of tell us a little more about it and tell us how these pollutants, both indoor and outdoor pollutants, are affecting children's health mainly because they are the most vulnerable of the lot. They are the ones who have to go down into the playgrounds and play, and probably the air pollution is going to curtail their freedom. So how is that impacting? Can you just tell us some idea about it?
Thank you very much, Dr. Jagrati and Nehal and Dr. Indu and all the others, respected Professor Tripathi, Sri Kadam. Gina has come out with these guidelines, but I think we know that this is an issue which has been with us for a long, long time. And we know that climate change and atmospheric pollution are interrelated. They're two sides of the same coin. And point is, the moment there is some degree of climate change, there is also an increase in air pollution. and a worsening of the allergies and asthma. And ultimately, asthma and allergic disorders are an inflammatory disorder. An inflammatory disorder starts with something that is irritating the airway. You can call it different names. You can call it eosinophilic predominant, neutrophilic predominant, or null cell predominant. But at the end of the day, it's inflammation. And all inflammation is going to get worse when there is atmospheric, whether it is secondary to virus. Again, we cannot put these into silos. We cannot say pollution comes in one place, infection comes in another place, and the genetic tendency comes in the third place. All of them are interlinked. And I think Gina has finally realized that we definitely need to start with the basics, that atmospheric change, that is the atmospheric pollution and climate change, are key contributors to our rise in allergic diseases.
Yeah, thank you, sir, for that insight. I would now like to direct a question to Professor Tripathi, sir. Sir, from your research, what do you think are the three main contributors to Mumbai's air pollution? And there have been some questions on the chat box about air quality index. As in, one of the main questions that has been asked, and it's been playing on my mind, is normally when we talk about AQI, we are talking about particulate matter more than 2.5 microns, but there could be many other noxious gases which are put up into the air. Now, how do those, are we able to pick them up? How do they matter to the overall AQI and overall the air quality? Can you just give us an idea about this?
Thank you, Dr. Sanghavi, and thanks for all the network of pediatrician. And I see my acquaintees who are here from Indian Express and Kedia, he's here for roping me in. Well, honestly, I haven't much researched Mumbai air quality, but what Kedia shared, this source apportionment report, I was just looking at it before joining this panel. And I saw that they had sampled, I think for 2019 or 20, only for summertime. Unfortunately, the report did not show any data for winter time, which is a more critical time for Mumbai or for any part of India because of other, atmospheric or weather-related activities. What I found from that report that for PM10, the major contributory sources were, I believe, dust, and then followed by, I think, industry and then something else. And for PM 2.5, it was industries, burning, and transport. So that is what, at least during summertime, what I could see. But regardless, I did see that summertime, out of the 6 locations they had sampled, I think 4 of them were more in central and west, and 2 were very close in the southern Mumbai, one Kolaba and one little north from Kolaba. And 4 places PM 2.5 had exceeded 60 microgram, which is the daily national air quality standard for PM 2.5, which is definitely, I would say, more than alarming. That is, I mean, as far as to answer your first question. Now, AQI is an index which, to my knowledge, has been created by incorporating all the critical air pollution, that is air, what they call air quality criteria pollutant, which are PM 2.5, PM 10, sulfur dioxide, nitrogen oxide, carbon monoxide, ozone. These are the 6 criteria pollutants, and I think they assign weights. And then AQI is actually a weighted average of all these 6 criteria pollutants. So in some way, basically, it factors into AQI, all the gases, etc. But PM 2.5 has a disproportionate, I think, contribution to overall AQI.
So, sir, would that matter in the overall air quality? I mean, having an index which may not be actually representative of what we look at air pollution?
Well, AQI has been now kind of a way to report because there are more than one pollution, as most of you have recognized. So therefore, in other parts of the world also, they say about AQI, but the practice elsewhere is that as the places like California, who has been pioneer in air quality management, and now over last 1.5 decades, Chinese have done tremendous work in that, in that field. They always also mention PM 2.5 because, as more than us, all the doctors know that it is a PM 2.5, which actually is probably the most harmful as far as the adverse human effects go. So that is where we are, that I think if at all we want to present AQI, and let's say that there is a matter of debate that AQI needs to be looked at it, that the way it is calculated currently has to be relooked at it. It's not only my opinion, this is a general opinion, but that something is to government to decide. But regardless, I think wherever we present AQI, we need to also present PM 2.5, because PM 2.5 is something which we all know that, actually could not be filtered by the upper part of our respiratory tract and then finally enters into blood and goes all the way deeper down. So it is important that PM 2.5 is accurately measured and be reported.
So, sir, these AQI monitoring devices which are there in the city of Bombay, from the previous chat and what Piyush and Pradeep also mentioned, that we have probably around 10 to 12 areas in a big city like Bombay, densely populated, highly industrialized, with so much of construction work going on. What is actually like, how much area should one particular monitoring device actually be able to take care of? Like, I mean, uh, how much area should it actually represent?
So, I mean, very difficult to say that one monitoring station, how much area one could represent. But World Meteorological Organization, World Health Organization, both from different perspective, I think has given some recommendation. And definitely India is way below in terms of per million, the number of monitoring stations we have. One of the reasons is that most of these monitoring devices, which are called continuous air quality monitoring stations, are imported. They are super expensive. Now, one or two of these OEMs who generally make it have established their factories here in India, but nevertheless, cost is prohibitively high. So just to give an idea that one monitoring station with 1 year, with establishment cost and maintenance for 4 years goes somewhere from 1 crore to 1.5 crore, which is very high. There are alternative options which has been adopted. It has been adopted across the world, and good amount of work, which is recognized by the global community, has been done in India. Now, already panelists have mentioned Kedia and Acharya on the rear panel. I don't want to be repetitive here. But the problem in India and including Mumbai is that we have a very heterogeneous society, and the economy is progressing very fast. All the economic activities are actually going very fast. Now, I was just looking before coming here that how Los Angeles, if you look any one of you, is a very similar kind of Los Angeles position is on the it's on the west coast of US. We are on the west coast of India. And then they have only one side or one and a half side, the ocean is covering LA, but we are covered about 2.5 sides. Now they are saying they have 300 plus monitoring stations. Now, given that LA is actually year long, 2024 PM 2.5 I was looking at is about less than 10 microgram per meter cube. And we had a PM 2.5, if we believe all our monitoring stations are accurately measuring it, is about 40 microgram. Now they have 300 plus monitoring stations. We have just about 15 or plus 520. So given that, I think from the point of view of whether you want to create policies at the level of Greater Mumbai metropolitan region, where you create airshed, which has been talked about, micro airshed, hotspot, and then finally actually making sure that enforcement is done at the ward level, the ward officials are held accountable in conjunction with the regulatory board people. It is important that we have more monitoring stations. It's just like you doctors, that you want more and more diagnostics. You don't administer drugs without having the proper diagnostics, right? So it is very important that we are talking about here as a very complex system, and our monitoring system is weak. But somewhat, despite having understood that, effort in that direction is not, I would say, adequate, to say the least.
So, sir, taking this cue from you, I would now direct a question to Sir Kadamji, because he is the one who is in the policy in the department, and he might be able to give us better idea. So, sir, I would like you to give us an idea about what are the current key regulations that are already in place in India and especially in Mumbai. I think most of the people who've joined here today are from Mumbai. That's the reason we are talking more and more about it. And I mean, like the earlier panelists mentioned, that Delhi has been already in the news for it, but Mumbai is getting worse from the air quality perspective. So if you are able to tell us about what are the key regulations which are there and what hurdles do the Pollution Control Board face to be able to, kind of put in these policies, that will be very nice. Welcome, sir.
Thank you. Thank you so much. Firstly, I'd like to, am I audible?
Yes, sir.
Yes. Firstly, I'd like to thank you, Dr. Indu Khoslaji, because she's the one who insisted me to be part of this particular dialogue. And she was a part of the dialogue which was hosted by us in the morning. And to the panelists, Dr. Jagdish and Mr. Tripathi, thank you so much for your inputs. So, Dr. Jagrati, so first of all, I would like to correct few misconceptions what are there. So, in the end of the previous discussion was going on, Mr. Pratik, I think he was the one who was speaking. So, it is as simple as that. So, there is an app called Samir app, which is free for all. If you just download that app, through that app, you'll get to know there are how many stations which are installed across the country. You just search Mumbai. There are 25 continuous air quality monitoring stations which are currently installed in Mumbai, which give you real-time air quality status, which is updated hourly. So if you download the app now, you will come to know at probably around 9 o'clock what was the air quality across Mumbai. So there are 25 stations which are already installed through various agencies. MPCB has installed, BMC has installed, Central Pollution Control Board has installed, ICT has installed. In totality, there are 25 stations. And to add, there are another 10 stations which are going to be installed in coming future. And as Mr. Tripathi rightly pointed, so one station costs around 70 lakh rupees. And to maintain that station, firstly, that station has to be in an air-conditioned container. It has to be manned 24/7. So all these things the government is already doing. And I don't know why. So probably I'll share the data with Dr. Indu. The air quality is not worsening of Mumbai. In fact, the air quality, if I share the data of last few years, I particularly talk about winters because that is when the air quality is worsening. That is what we see is in fact improving, because the only reason is the kind of regulation what we are imposing. I'll give you a smallest of example. So during the last winter, the moment we saw the AQI, so AQI is basically, so Dr. Jagriti, one of the question was in that parameters. So if you can see, if you open that app, in that app,
Yes.
you get to see there is NOx, there is SO2, there is PM 2.5, there is PM 10, there is ozone. You get to see everything. And plus, you'll get to see the past data as well. So you can compare. And this is open to public. This is not just for me or you. In fact, this is open to public. And everybody refers to this app. So again, coming to the previous point, during the winters. So wherever throughout the Mumbai, we saw the air quality is worsening, we took immediate action. The smallest example I'll give you, because right now in Mumbai, there is massive infrastructure work going on, massive construction work going on. So one of the areas where we saw the air quality was worsening was in Borivali, and the other one what we saw in Kolaba. So at Navy Nagar. So we took immediate steps. We had halted construction for a week, or probably till the time the air quality didn't get better. So government has taken effective steps. So there is more continuous monitoring which happens. And obviously, the previous, the panelist, Mr. Pratik, he said that probably the MPCB doesn't have much tools or much power, but it's the other way around. So MPCB has all the teeth. Probably I can go and prosecute the municipal commissioner of Mumbai as well. So MPCB has more power than compared to any municipal commissioner across the state. I can prosecute them. It can be a legal prosecution as well. So, but we leave the implementation part to the local bodies. We are the regulatory bodies. We have to get the work done. So coming back to Mumbai, there are effective steps which keep on taking. Like, for example, I'll particularly talk about the winters only. During the winters, as Dr. Indu was in the morning session as well, So we explain how the air quality, it's a scientific phenomena. What happens, probably everyone is aware about that. So during that period, the dust, that is PM 2.5 and PM 10, it shouldn't go in the atmosphere, like it shouldn't raise. So we take precautions for that. So as simple as that, washing the roads, putting up fountain. If you like, everyone's a Mumbaikar over here. If you remember, in a few years back, we used to have this, water fountains in an island. So whole logic behind that, so the dust doesn't go out in the atmosphere, though it was for the beautification purpose as well. So such simple solutions like misting. Then there's one more implementation. What's been done is every construction site, it has a continuous air quality monitoring station. Every construction site, and that is linked to our online database, which I get to see on my portal. Which construction site, wherever we see the air quality is deteriorating in that particular construction site, I'm saying a smallest of building construction going on, we immediately take action on that. Secondly, as you're all aware, in Mumbai, one of the reasons what complaints we regularly get is these RMC plants, the ready mix plant, which are haphazardly were given permission all this while. So one of the initiatives what we have taken is none of the RMC plants, because again that is PM 2.5 and PM 10, because those are small particles of cement and dust through these plants. So we have come up with guidelines in November when in the entire plant has to be covered in a tin shed, entire plant. So it is costly for one plant to set up a plant. It is 2.5 crore, but for them to make this modification, it's going to cost them 1.5 crore. So we are imposing such new regulations to them. But having said that, Mumbai is developing, and of course there has to be a balance of development as well as how much pollution can a particular city carry. So that thin balance, it is a critical balance. But having said that, we are in a phase of development. Mumbai has never seen such a rapid development. Obviously, we've seen development, but Mumbai has never seen such a rapid development. There is metro, there is coastal road, there is interlink roads happening, there is concretization of Mumbai happening. So everything's happening at once. Probably we are the worst generation to go through the same phase because we saw COVID, we saw war, and we saw massive construction phase as well happening. But as we are very optimistic, because given in the future going ahead, this will subside because the data shows that the air quality is not worsening. Through our strict regulations, it is not becoming better, but definitely we are not letting it get worse as well. So I think there are a lot of things what we are initiating, and also the previous panelist said that there is industrial pollution. I'm very surprised that there are hardly any industries which are on Mumbai. There is no industrial pollution in Mumbai. The only pollution that causes is the vehicular pollution. The average traffic speed in Mumbai, like you'll be zapped when you, is 20 kilometers per hour. That is the average speed. So you can imagine how much the pollution is happening through the exhaust. These are the fumes which are coming out from the vehicles because they're getting stuck in the traffic. Now, how many of us do actually use public transport? None of us, like very few. Secondly, how many of us use only one car? Every family must be having 2 or 3 cars. Husband will drive in one car, wife will drive in one car, kid will drive in one car, grandparents will drive in another car. So one family on an average now has at least 2 vehicles. That is shocking. I'm just talking about 4-wheelers. 2-wheelers, I'm not even talking about them. Plus, and then no one wants to walk. No one wants to walk. And public transport. Obviously, I know that there's still no last mile connectivity, but still, unless we take effective steps as citizens, this as a regulatory body, I cannot do it alone, or we cannot do it alone. Like BMC cannot do it alone. I cannot do it alone. Neither state government can do it alone. There are regulations, but in the previous discussion, Dr. Khosla was there. We are of the opinion there is no need for us to be in existence. Why should I tell someone what is right and what is wrong? It is the same air what we all breathe. If everybody realizes that, okay, I shouldn't be driving every day, probably there is public transport available, I will use that. There is no need for me to come and regulate to anybody. And having said that, I think, Indujit, this is a very great initiative, and such dialogue should continue happening. In fact, as MPCB, soon we'll be launching a program as well, wherein through that program, I'll be having such constant dialogues with experts from across the sectors. So, university students, ALMs, yourself, professionals, industries, scientists, experts, everybody. So, I think, Dr. Jagrati, I hope I've done justice
I,
and I've answered what you were
Absolutely,
expecting.
absolutely, sir. In fact, it is very heartening to know that the government is taking very, very positive steps towards it. And like you said, it is like all kind of good luck or goodwill, everything comes from within. So the first step has to be taken by the individual themselves. But having said that, when we are living in a very, very large population with not too much of literacy, we might need to impose certain rules and regulations. So like, I mean, even if we go back to Delhi where they talked about odd and even cars, there was a lot of memes and there was a lot of trolling that took place. But something, I mean, it sounded very odd on the face of it, but at least there was something that was done towards trying to curtail. Like you said very rightly, that if me and my husband have to go to different places, we would both end up taking our cars. But the fact still remains that there has to be some regulations, and it is a very good thing, sir, that you're saying that you are going to be connecting with a lot of professionals as well as common citizens to make them aware, because I think awareness is the key. And I mean, on behalf of IIP Mumbai and IIP overall, I think Dr. Indu Khosla has taken this lead to actually, kind of make us also rethink on how we are responsible for, the air pollution itself. So I think, sir, it is really good that you have clarified a lot of things that we have. But I also would like Tripathi sir to come in. If he could explain us that there have been, like you mentioned, about some low cost scalable technologies for AQIs, whether those can get incorporated in the system so that we are able to monitor. I mean, of course, Siddesh ji just mentioned about the app, and I actually immediately downloaded it. So yes, it does show. Yeah, Dr. Khosla has also downloaded it. So essentially, it is showing like you said, continuous changes that are there in the AQI. But are there any low cost scalable technologies that have been used elsewhere in the world, where we can use them as models? Like I think earlier panelists mentioned about Beijing model, or somebody in the panel had mentioned about some skyscraper sized AQI monitoring that is happening in China or something. So are there such things to take some cues from?
Well, I mean, cleaning from the air as large, like skyscraper-based tower and all, I think that doesn't work. Let me tell you very clearly, we should steer away from that. There were smog towers; those were installed in Delhi. They failed miserably, so we should not think about that ever. Now, certainly, these low-cost sensors, which is being used by many cities in US, in UK, in France, in China. And there is tremendous amount of work that has been done in India and all published. In fact, some of the work is now being cited and used by US EPA, Environmental Protection Agency, the leading environment agency or regulator of US. Now, what this could do, just to basically follow what Chairman of Maharashtra Pollution Control Board mentioned, that when you are trying to basically enforce something, just think about the size of your ward. So Greater Mumbai has an area of about 600 square kilometer or little more or less. Now, any given time, not all the 25 monitors work. Generally, 20 monitors give you data. So you divide 600 by 20. You have one data in every 30 square kilometer. This is a very large area. You cannot take targeted actions. Basically, if you want targeted action, you want to have data point coming in every square kilometer. This is not going to have you a lot of cost. In fact, if you put another few hundred sensors, it's going to cost you few tens of crores more at the most, maybe 100 crore. But in these 100 crore, you are going to have a data point in every square kilometer area. Now you can bring a lot of other multi-modality, that data from sensor data, which is coming from your robust government monitoring network. You can pull in the satellite data, and then in fact, you can create a dynamic map of PM 2.5, PM 10, etc., and other gases also, excuse me, in future, at a resolution of a square kilometer or 200 square meter. Now, this then can also be used using AI. AI can be leveraged to provide you the source attribution. Then when you see a hot spot at a city block level, which I'm talking about 200 square meter or square kilometer, you can precisely tell what industry, whether it's a road building effort or a construction effort, is actually making that particular point a hotspot, and whether that source in a very dynamic way, that any given time, that 4 o'clock, it's that source basically originated, and it is making this particular spot of Andheri a hotspot. That is kind of information you need, because otherwise you continue to expand these monitors, which are so expensive. You are spending money on import, very difficult to monitor and maintain. You can never be able to really understand that what is going on at a level where you need to enforce and be complied with. So that is where I think we can make a lot of progress, and there is a lot of room there. Second, I would again say that look at California. I mean, this is something what they have done. We have to recognize it. Or Shanghai, that number of people who are working as a part of regulatory board need to go up. Now, the scientists, the engineer, the technologist, and the legal professionals are huge. And there is a role for each one of them, right? Right from basically creating a basis for basically creating the regulation, that is the science-based regulation, then creating in-house technological development where all these things can come out from MPCB, and then, of course, the legal professionals who can stand up in the court and thereby defend their decisions, right? So that is the kind of a battery of people we need to have more teeth. I agree, and everyone agrees that there is teeth with the regulators, but we need to have you more teeth on that. So that is where I think we can make a lot of progress. And I finally end up that, look, Mumbai, Greater Mumbai and Mumbai Metropolitan Development Region can actually become a role model for other part of the country. Because first, it's the financial workhorse of the country. It has the most educated and aware people. There are doctors who are coming forward, and at 10:30 they are discussing, right, coming out from the clinic. My son is doctor. I know that the kind of work he does as a MS surgery. So we all know that if all of you are coming, there is the complete possibility to create this system, which becomes the role model for an effective air quality management for this country. Now, this is up to Mumbaikar to decide whether they want to take that challenge.
Thank you so much, Mr. Tripathi, for this.
So,
I just
Jagrati,
want,
if
yeah, sure.
just yeah. So what Mr. Tripathi said, that having multiple air quality stations, I completely agree. And I believe in my previous my submission, I said that's what I said. So there are 130 RNC plants in Mumbai. Every construction, they have air quality monitoring stations. Every construction site, so every building construction site has air quality monitoring stations. And these monitoring stations, they relay their data to our database, which is visible to me, because it is not a data which will be shared with the public. But I can see which RMC plant, which construction site is crossing a particular threshold. So,
what is that threshold? Sorry to interrupt you. What is
so,
that threshold?
so AQI. So basically, what you see in Samir app.
AQI of what is the criteria for cutoff?
So if you see in Samir app, so basically, see, getting in the green zone right now below 80 is the best thing. So right now, because of the monsoon, we are around that 80. But we don't let it cross beyond 100, beyond 120. The moment we see that, we make sure we take corrective measures. So collectively, if I get to see, there are around hundreds of stations, hundred of data points what we have within the city. So we do have those data points already in place within the city, and we do analyze that. There is a particular department within the MPCB which only looks at the air pollution of Mumbai, Joint Director Air, which is particularly deputed only for air pollution of Mumbai. And having said that, the court itself, with the National Clean Healthcare Program, through that also we take a lot of initiative. So it is not just that we do it collectively, but also with the court, with the judiciary, with the central government, with the state government, and with the local body. It is a collective effort. So again, what Mr. Tripathi had pointed out earlier, to have more stations. So my submission is that we already have enough stations, which are these remote stations. Like for example, be it in Kolaba, for example, if there are 10 construction sites happening, so every construction site should have a monitoring station which will relay that data to our portal. So that is already in place. So I think that's my submission towards it. And see about
So,
these, and when it comes to putting up the stations, cost is not an issue, because that can be the, because I don't want to get a low quality or something like that which is not proven technology. Because again, low quality, not necessarily it has to be, I mean, it will be a proven technology, because there are a lot of startups which come up. But again, if it's not, technology is not proven, I can't just go and buy because it's cheap. I have to go with the technology which is proven. If it's expensive, it's expensive. It's going to cost me. It's going to cost me. Because when it comes to data points, if I don't get right data, I cannot take effective steps. So cost is not a concern, neither for me, neither for government, when it comes to data points or taking effective steps.
thank you so much, sir. Sir, because of shortage of time, I'm going to wrap up by asking one question to each one of you. To Dr. Jagdish Chinappa, I would like you to tell us that what role do you think can pediatricians play in air quality advocacy? Like, how can we make a difference to the life of children whom we deal day in and day out?
Thank you for that question. I think it has been a very fascinating discussion. And I think air pollution has to be handled by all of us. It cannot be handled by any one of us. And I think the primary goal that we can take as doctors is to sensitize parents and sensitize children about how they can bring down air pollution in many ways. You can even start with a simple thing of no car day for going to school, or bicycle day, or walk to school day, or something like that. So small steps which we can do in the clinic every day can definitely make a difference, because I think it's not just the job of the pollution control board or the policymakers, but I think the population and the people need to get involved too. And as advocates for children, where we are in touch with large number of parents and children, sensitizing them will make a lot of difference.
Thank you so much, Dr. Chinappa. If Dr. Sachidanand, I can't see him. Okay, so, Siddheshji, to you, I want to know that as citizens, how can we, if we find any violators, how do we complain? Which is the right, say maybe an email address or a number or some kind of a WhatsApp place where we can actually put in complaints which would be heard. And I'm sure that would be useful to you as a team, that more and more people are getting alert and aware about air pollution around them. So can you just suggest?
Well, Dr. Jagruti, I would insist you to download one more app called Mahaparyavaran app. So that app is, we've launched it today. That is for grievances for citizens. So any grievances what citizens see or they want to bring it to our notice, they can just go on that app, and we will make sure that we'll try and address everything. Because secondly, my email address, I'm accessible. State government is accessible. In fact, our social media handles are also quite active. So wherever I'm getting tagged, I make sure I revert to that and try and resolve that as well. Because there are various mediums. But as I said, Mahaparyavaran app is one of the medium. Then my email address, anyone can mail me through any of the grievances. Anyone can tag me on my social media handles as well. Anyone can tag on the social media handles of MPCB, CPCB, state government. Because when it comes to pollution, everyone is very serious about it. And we try and resolve everything. I'm not saying that we are 100% in resolving everything, but we try and resolve every grievances or every complaint what comes to us. So these are the platforms what are available. And I would my last submission will be is what Dr. Jagdish also recommended is probably coming up with a solution called a no vehicle. But I think even odd is tried and tested in Delhi. It doesn't work. So I think we shouldn't do that. But obviously, I mean, the no vehicle, I think that is a very good initiative, and using of public transport. I mean, I know there is still no last mile connectivity, but eventually it will happen because we are getting there. But till the time, even if it doesn't happen, we still have to try to use public transport.
Yes, sir, there is enough light. I think with the growing metros and all, I do see a lot of people who are now trying to use it because of ease of reaching a place at a particular time faster than the roads would take you. So I'm sure with better connectivity, Mumbai is definitely going to get better. And thank you so much for all of you to give this much of time. I would like to especially, mention Mr. Vikrant Latkar on the participants, one of the person who has been with us, and he's been actually commenting quite a lot on the chat box. A few of the questions that I have asked the panelists have also been asked by him. So thank you, sir, for being such an aware citizen. And with this, I am grateful to somebody like Sachidanand Tripathi, sir, Siddesh Kadamji, Pratip Acharya, Piyush ji, and of course our esteemed doctors for bringing this discussion. And so let's not end this discussion here. Let's carry it to our clinics, to our communities, to our conversations with people with a renewed sense of urgency and commitment. Because clean air, as we all know, is not a privilege. It is our right. And especially for the youngest and the most vulnerable amongst us, our children, our patients. And thank you, everybody, for being a part of today's conversation and to bring in the awareness about indoor pollutants, because as much as outdoor pollutants are affecting us, it's also the indoor pollutants which are causing allergies in children. I invite Dr. Tanvi Modi, who's a fellow in pediatric pulmonology at the SRCC hospital. Dr. Tanvi Modi, you can talk about indoor pollutants.
Thank you, ma'am. Thank you all the dignitaries, Indu ma'am, for the opportunity. I'm just going to share my screen. After that very engaging discussion on outdoor pollution, ambient pollution, we will now move to indoor pollutants. This talk was supposed to be originally taken by Dr. Kalpanwar sir, who could not attend due to an emergency. So I'm very honored to be able to present it on his behalf. Indoor air pollutants are lesser known, lesser recognized, and we live in that bubble thinking we're indoors, so we are fine, we are safe. As we found out today also, that being in an AC and indoor environment is not necessary that you're safe. In India, it has been shown that among rural population, 73% of households rely on biomass fuel. India is on the top of the list among countries with the largest population lacking access to cleaner fuel for cooking. It can be up to 10 times worse than outdoor air pollution. And poor indoor air quality contributes 1.3 million deaths in India each year. This is the magnitude of the problem of indoor air pollution. The severity of effects will vary, starting from initially mild lung function decrements, inflammation, higher susceptibility to respiratory tract infections, cardiac problems. They'll gradually worsen to exacerbation of asthma, respiratory symptoms. They'll lead to doctor's visits, school absences, then eventually worsening and going to emergency room visits, hospital admissions, and of course, the worst, death, if they are not tackled with at the grassroots level. So what are these in these indoor air pollutants? These are nothing but particulate matter, carbon monoxide, secondhand tobacco smoke, pesticides, volatile organic compounds, biological pollutants, the building environment, radon, asbestos, and occupation-related contaminants. Indoor air quality is influenced by all the following, which we've already discussed. Outdoor air pollution, as a common example that we are already aware of, is that it's been proven that a road facing house versus even about 50 meters into a lane facing a non-road facing house can significantly decrease the risk of exacerbations of respiratory complaints. Secondhand tobacco smoke, biomass fuels, poorly ventilated homes, overcrowded homes, and old customs, habits, and traditions, which the older generation definitely follows. Children are uniquely vulnerable because they inhale more pollutants per kg of body weight than the adults do. Their airways are narrower. They have irritation, which can result in a proportionately larger amount of airway obstruction and exacerbate their symptoms more. They have immature lungs, and all of these contribute to why they are more affected by indoor air pollution. Younger infants also tend to spend a larger amount of time indoors than older children and adults. What is this particulate matter? We've already seen this. They're extremely small solid particles. And the reason we're all focusing so much on PM 2.5 is because these are the particles that can actually reach the terminal bronchioles and alveoli and cause the lasting lung damage. Not just directly to children, there are studies to prove that even antenatal exposure, maternal particulate matter exposure, can increase oxidative stress in the wound. They can cause immune dysregulation in the fetus and can cause a fetus can be born with smaller lungs, lower lung capacity, stunting, failure to thrive, as Dr. Indu ma'am has already highlighted earlier. We'll present a case. The first case is a 4-year-old girl belonging to a lower socioeconomic strata, presents with a history of cough, noisy breathing since 1 week. There's no history of fever, running nose, coryza, no family history of asthma allergy, and past history revealed that she's getting recurrent paroxysmal coughs early in the morning, exertional cough, and similar episodes since the age of 3 years. And between these episodes, also the child was symptomatic. Father was a non-smoker. On examination, she was tachypnic. There was no clubbing, no cyanosis maintaining saturation, but bilateral air entry was reduced on examination with bilateral bronchi present. The clinical diagnosis was asthma. She was treated as per the GINA guidelines, but there was no improvement. In view of persistent symptoms, a detailed history was taken, which revealed that the child was living in a single room house where biofuel was used as routine for water boiling, even though they were using LPG cylinders for cooking. This is a very common complaint in lower socioeconomic situations. As ma'am pointed out, that this is the socioeconomic history which we take right at the end of our history taking, which we actually should in current times delve into right in the beginning. This is how the water was being boiled using biofuels. Parents were then counseled to avoid biofuels. They switched to solar panels, and that is when the child became free of symptoms and the drugs were stepped down to the bare minimum till she recovered. The next one is secondhand tobacco smoke. The magnitude of the problems. Children whose mothers smoke have a 70% higher rate of respiratory problems, 38% higher risk of pneumonia and hospitalizations, 80% higher infant mortality. And 20% of all infant mortality could be avoided if all pregnant women quit smoking. Smoking parents, children have 60% more respiratory illnesses, 21% more of asthma and exacerbations, 50% more chances of recurrent otitis media and childhood malignancies. Other commonly found indoor air pollutants are solvents, volatile organic compounds. These are fabric softeners, deodorizers, the air purifying agents, paints, glues, the air fresheners, pens, markers, binders, hairsprays, perfumes, all of these. These we can see the abundance of these in an illustrative manner. All of these, which have a high, depending on their high or low level of water solubility, have an impact on different organs. So the high water solubility ones predominantly affect eyes, nose, larynx, pharynx, and the low water solubility ones are the ones that can affect bronchioles and alveoli, like nitrogen dioxide and phosgene. Volatile organic compounds will cause acute effects like irritation of the eyes, breathing difficulties, rashes, dizziness, and allergies. But in the long term, they have been found to damage liver, kidney, the blood cells, central nervous system, and are even linked to some malignancies like formaldehyde. After this, biological pollutants. These are nothing but living organisms, or based out of living organisms, like animal dander, cat dander, dust mites, molds in the wall, infectious agents, pollens, and sources of these could be water damaged surfaces or materials like damp walls, humidifiers, stagnant water, water vapor, air conditioning systems, which are a very common cause of respiratory tract infections indoor, mattresses, upholstered furniture, and carpets which catch dust. Indoor molds are a very underrated cause of illness. They occur in damp indoor areas, and of course, living in Mumbai, we all know the halat of our houses in the rainy season, which is now approaching. So we have to be very careful not to allow damp walls. They will present initially with allergies, non-specific symptoms, but infections could be rare. Mold related disease. Mold is nothing but the fungal manifestations, which have airway and conjunctival irritation, headaches, and they'll have seemingly minor effects like difficulty in concentrating and headaches and weakness, fatigue, to more severe ones like hypersensitivity reactions, systemic invasive manifestations in immunosuppressed children, pulmonary hemorrhage in infants also. On this note, I'll bring you to the next case, which is a previously well 13-year-old boy presented with a history of breathlessness, fever, chills, and blood in his cough since the last 2 days. He was tachypnic, his saturation was 86% only on room air, and he was diagnosed as a community acquired pneumonia. Admitted to the ER, given O2, given IV fluids, given antibiotics, and the usual routine of treatment. But he did not improve. Saturation still remained low despite 6 liters of O2. His hemoglobin was 8, TLC was 5,000, platelets were on the lower side, 90,000. And this was his chest X-ray. Anyone seeing it will treat it as a pneumonia and upgrade antibiotics, as the usual practice is. But delving further into the case, he was transferred to the intensive care for mechanical ventilation, and he was just not improving with higher antibiotics and management. He remained unstable, required inotropes, had acute cardiomyopathy, thought to be secondary to sepsis. A detailed social history at this point taken from the mother reported that for the past 4 years, the family has lived in a rented house which got noticeably damp and moldy. And over that period of time, her husband complained of sleep disturbances due to an asthma-like illness. A bronchoscopy was done and bronchoalveolar lavage fluid was sent for analysis. It turned out to be aspergillosis. Aspergillosis and was treated with itraconazole for 2 weeks and oral itraconazole for another 2 weeks. Now, aspergillosis is rare to be seen in immunocompetent children unless it's allergic bronchopulmonary aspergillosis in severe uncontrolled asthma or cystic fibrosis. Now, what do we do to protect these tender lungs? The government policies, I'm going to go over this quickly because we've already dealt with a lot of this in the past, in the previous panel discussion. So the government has launched this National Clean Air Program to tackle air pollution, and these are the targets. Then the building requirements, as Kadam sir has also said, that they all keep a very strict target on all the construction. So these are the building ventilation requirements. It is necessary to ventilate because the carbon dioxide, all the equipment, technology, animals, outside pollutants, radon, all of these contribute to the indoor air pollution following construction. Older homes, in fact, had better cross ventilation than our newer constructions. Indoor plants are now being found to effectively reduce the carbon dioxide, absorb VOCs and formaldehyde. And common plants are these, the snake plant, areca palms, all the other plants, money plant, and they're actually recommended to keep indoors now. What can we do? Eliminate or control all these known sources of pollution. We can choose even cooking methods, cooking stoves, opt for electric kettles have also been found to decrease indoor air pollution and particulate matter by 51% in one study worldwide, and more so in lower middle income countries. Even methods of cooking like boiling versus frying and dry roasting have been shown to decrease particulate matter in some studies worldwide. Education to children, family, healthcare providers about these indoor sources, to recognize these triggers, to cut down on indoor air pollutants when we cannot find any apparent outdoor environmental triggers. And of course, environment policy making like framework convention on tobacco control, clean indoor air regulations, community actions, and research into the same. So if we don't act now, our future looks grim. So on that note, I thank you very much. And once again, Dr. Kalpanwar needs credit for this presentation. Thank you, everyone.
Thank you, Dr.
Questions?
Tanvi. So I think I should tell this to everybody that it was just before half an hour that we learned that sir may not be able to join because of some family emergency. And that was when Dr. Tanvi took this up. And Tanvi, you have really given us a very concise and a very crisp overview of the interpollutants also, which contribute to the respiratory illnesses in children. Thanks a lot.
Thank you for the
So,
opportunity.
before we conclude this program, I think it's a whopping 10:45 and we are all still here. It's 1 hour 45 minutes. Before we conclude, we also want to share that IIP Mumbai along with IIP NRC has designed some illustrative posters for use for us all at display at nursing homes, clinics, OPDs, hospitals. Probably even share it with the patient related groups that we have, awareness groups that we have. And I would request Abhinaya to share it on the screen today. So today being the World Environment Day, I would also take this opportunity to thank Dr. Jagdish sir for helping us connect to make these posters. Thank you very much, sir. And these are very nice illustrative posters which tell us about common indoor air pollutants and outdoor air pollutants that play a major role in the rise of these non-infective respiratory illnesses, which we are seeing. All of us are seeing a big hike in that. So these are the posters. These will be shared in different groups also, different member groups and zones as well. So anybody who wants to download them, get their printouts, laminate and put them up is definitely free to use them. Thank you so much. And now, before we conclude, I would like to thank, on behalf of IIP Mumbai, I would like to thank our two excellent, young and very engaging and interactive moderators for today's panels, Dr. Abhinaya and Dr. Jagruti, for having this very enlightening discussion that came along on this World Environment Day and our topic on voice for clean air. Special thanks to all the panelists, and of course we don't have Siddesh, Mr. Kadam and Professor Tripathi ji. I think they've already exited, but I think Mr. Piyush and Mr. Pratik, thank you so much for joining in. We had heard you on a previous occasion also. We have been interacting on the groups also, and I think there are excellent insights and excellent moves and measures that both of you have been doing for creating awareness and at the same time working also towards a lot of environmental pollution. It has been very heartening to know that a lot of positive steps are also being taken by the government as far as the pollution in the city of Mumbai is concerned. But yet the fact does remain that we as pediatricians are seeing definitely a growth in the non-infective respiratory illnesses, to which contributing factors are, as all our panelists have pointed out. Thank you, Dr. Jagdish Chinnappa sir, for joining us today. And of course, a special thanks to Dr. Indu Khosla madam for actually conceptualizing this entire CME, getting all these people together. I think everything about this environmental pollution related thing, right from the causes, the measures, what can be done, what do the stakeholders have to do, and definitely what is the pediatrician's role. I think getting all that together, thank you so much, madam. And of course, thank you all the participants who have been there for such a long time and being a part of this program. Thank you so much. Madam, if you want to say something, Dr. Rawat sir, if you want to say something before.
Over to Dr. Rawat. I think you've said it all well.
Thank you very much, Dr. Nail. Thank you very much. I think Mumbai, Dr. Indu Khosla. I think All the inputs have been excellent, and the essence, the take-home message is that we at our clinics and at individual level we should start taking action, because if you don't act and if we act inert and we look to the government, nothing is going to change. So let us do some doable act, like for example, a simple thing like for example, we are going to share those chart. Just display this chart in your clinics, in your hospitals, and that will create some noise and some awareness. Start using more and more bicycles at a level, and try to use car as less as possible. So try to do small things at your level. I think it will make a good impact. So I think thank you very much. Taipei RC really thanks all the participants and IIT Mumbai, especially Dr. Indu, for taking the initiative and making a great program. Thank you very much.
Thank you so much.
Thank you, everybody. Thank you. Good night.
Good night, all.
Thank
Good
you.
night, everybody.
Thank you, everyone. Thank you.
Thank you. Good night.
Thank you, Mr. Vikram. Thank you so much for being so interactive and interested in this entire conversation today.